I'm now really happy and delighted to introduce our next speaker, who is the Victorian Public Service Commissioner, Paul Grimes. Paul comes with an absolute helicopter perspective of this, because the Public Service Commission itself has been conducting the People Matter survey for quite a few years, and has been making it very clear to us that we do have workplaces that seem to be covering a whole range of very unacceptable behaviours that are leading quite large percentages of our workforce to speak out about this, albeit in a kind of almost silent way through a survey, but they are certainly telling us something. And Paul is someone, I think, who has a breadth of experience that he is able to bring to this role. He was appointed as the Victorian Public Service Commissioner in January of this year. He's a career public servant, but he has worked almost everywhere, it seems to me. He previously served as Secretary of the Australian Government Department of Agriculture, and earlier than that, the Australian Government Department of Sustainability, Environment, Water, Population and Communities. But not only that, prior to that, he worked in the departments of Domestic Policy in the Department of Prime Minister and Cabinet. He was in the Finance Department. He has also worked in South Australia as a Deputy Secretary in their Treasury and Finance Department, and as the Chief Executive of the ACT Department of Treasury. He's also been an independent advisor and public sector and policy consultant. He was awarded a Public Service Medal for his contribution to the development of Australia's response to the global financial crisis in 2008-9, seems a long time ago now, and he holds a PhD and Master's degree in economics from the Australian National University. Paul's topic for us today is the prevalence, not surprisingly, given the role of the Public Service Commission, the prevalence of inappropriate behaviour in healthcare, and most importantly, your role in addressing it. Please welcome Commissioner Grimes.
Thank you, Fran, for that introduction, and thank you everyone for the opportunity to be able to speak with you here today. I would also like to commence my remarks by acknowledging that we're meeting on the lands of the people of the Kulin Nations, and pay respects also to the elders past and present, and to any Aboriginal people who may be with us here today. It's, as I say, a real pleasure to be able to join you to talk about this very, very important topic, and I hope some of the things I have to say will really echo and fit quite naturally around those points that Kim made in her opening comments. I think we've got an opportunity to make really important progress on an important topic for us. So today I want to talk about a couple of things in particular. One is the role of the Victorian Public Sector Commission, the work that we do, and the role that we can play to help you, and the important role that we play in working very, very closely with the Department of Health and Human Services. Also want to take the opportunity to do a slightly deeper dive into what the data are telling us, following Kim's comments a moment ago. Kim picked out the headlines, and I'd like to sort of go a little bit further in behind those headlines to form a good foundation for your discussion today. I see one of the most valuable aspects of today as being the opportunity for you to come together as a group of chairs and chief executives and senior HR professionals to talk about your lessons, experiences, insights, to learn from each other and to share different perspectives. But I hope some of the comments that I make over the next few minutes will be helpful background in setting the scene for your deeper discussions through the course of the day. Of course, all of us are subject to the provisions of the Public Administration Act, We're all public officials, and we're bound by the codes of conduct which are set out in the Public Administration Act and are further articulated by the Victorian Public Sector Commission. We play a very important role in setting those codes and monitoring compliance with the codes. We issue 2 particular codes for directors. You'll be familiar with this code. It's the small blue book, the Code of Conduct for Directors, which set out the obligations of public sector directors in Victoria. There is a similar booklet for those of us who are employees, public sector employees within the Victorian public sector. An important element of our values that are set out in the Public Administration Act is very explicitly a value around the notion of respect. Spelt out in the Act and making it very clear that we have an obligation to ensure that there's freedom from discrimination, harassment and bullying in our workplaces, and that's the language that's used directly within the Act. Important to remember our role in promoting the public sector employment principles. Leaders are responsible for promoting these values, and particularly in providing leadership. And the Act says quite explicitly, public officials should demonstrate leadership by actively implementing, promoting and supporting the values. So the work that you're doing today, I think, fits very nicely within that framework under the Act. So said at the outset, I'd like to talk a little bit more about some of the key findings out of the People Matter survey for this year, 2018. Some observations out of that survey and maybe 1 or 2 insights. The survey, as you know, has the participation of all health services within Victoria. So we have 84 entities responded to the survey this year, and almost 50,000 employees from the health sector, 47,000 from memory respondents. So almost half of all the respondents to the People Matter survey from the health sector. Response rates from the health sector are just under 50% and broadly in line with the public sector as a whole. What was really pleasing from a Commission perspective was to see a substantial increase in the number of respondents to the People Matter survey between last year and this year, and I think that really highlights the work that you've been doing in promoting active engagement in the survey in the health sector, and that's complemented the work that's been done by other public sector leaders here in Victoria to increase response rates to that survey, because this is one of our most important sources of information and evidence on how we're performing in promoting our values within the public sector. So what do the data show us? The first set of indicators I'm going to go through are around sexual harassment in the workplace, and in particular respondents responding to that question whether they've experienced sexual harassment in the workplace. And the figures that I've got here are broken down by different levels of health service. So 11% of staff in metropolitan and teaching health services say that they've experienced sexual harassment in their workplace. For regional health services, the same number, 11%. You'll see a slightly lower picture in the rural health services at 8%. And for small rural health services, 8% as well. Overall, in public health, a 10% response rate, which is actually a very high response rate. 10% of our staff. That means of that almost 50,000 employees who responded directly to this survey in the health sector, almost 5,000 of them reported having experienced sexual harassment in their workplace. That is in line with the level of sexual harassment that we see across the Victorian public sector as a whole. Earlier this year, the Victorian Secretaries Board issued a very powerful statement recognising that the level of sexual harassment within our sector is too high, and we must be working decisively to reduce those levels. A breakdown by occupational groups I thought would be very useful to you here today. So just getting in behind those numbers and looking at which of our employees have been particularly affected by sexual harassment in the workplace. So these are those that have reported sexual harassment by different broad occupational groups within the health sector, running from nursing employees through to allied health professionals, medical employees, and then corporate and administrative staff. And you'll see that we have the highest reported rate amongst our nursing staff. And that's a theme that comes out in some of the other key statistics. The next line of figures that I've shown here are really quite significant. They show the impact and the prevalence of sexual harassment, particularly for our younger workers. This is particularly for workers that are under 35 years of age. And you'll see for younger female workers, there's a much, much higher level of sexual harassment, very, very significant. Overall, for our nursing workforce, it's heading up towards 20%. Almost 1 in 5 report sexual harassment in the workplace. Kim briefly mentioned some of the insights from the data on the response of people who have been sexually harassed to that, and what they have done and what they report they've done in the People Matter survey. And I thought it'd be useful to actually step through those figures in a little bit more detail for you here today. So this is the victims' response to sexual harassment incidents. First response was just to pretend that it didn't bother the person. It's amazing, we've got 42% of our staff that just pretend that it didn't bother them. Tried to laugh it off or forget about it, 39%. Avoided the person by staying away from them, 34%. Told the person that the behaviour was not okay, 33%. Avoided locations where the behaviour might occur, 13%. This next one is made a formal complaint, 6%, which really highlights the issue that we've got is raising awareness about the avenues to be able to complain and the scope for dealing with the sexual harassment concerns of our workers in the workplace. That's a really significant statistic, though, I think. We've got almost 5,000 people directly reporting sexual harassment in the workplace, and only 6% had made a formal complaint of one sort or another. And it's perhaps not surprising when we see the way in which our staff perceive actions in response to complaints that are made. And so this graph sets out the reasons why people might not have submitted a formal complaint. First of all, 4%, I didn't know who to talk to or how to make a complaint. Secondly, I believe there would be negative consequences for my career, 16%. I believe there'd be negative consequences for my reputation, 27%, and then I didn't think it would make a difference, 49%. When people make complaints, the People Matter survey drills down a little further to see what would the experience of people who'd suffered sexual harassment and had made a complaint, and asked the question, were you satisfied with the outcome of the complaint that you lodged in response to a sexual harassment incident? And you'll see there that 24% indicated that they were not sure, 37% indicated that they were not satisfied, and only 39% indicated that they were satisfied in the way in which the complaint was handled. One of the important things that Kim said right at the outset with her comments was the importance about shifting from a focus on the blaming the victim in our procedures, and ensuring that we're standing more in the shoes of the people who are lodging complaints. This year, the Public Sector Commission is leading important work within the Victorian public sector as a whole around responding to the issue of sexual harassment, and in particular, finding ways of better sharing our experiences and practices for responding to sexual harassment, so that we can find better strategies that are going to give our staff greater confidence that if they make a complaint, that complaint is going to be acted on and dealt with appropriately. And that work is being led by our Deputy Commissioner, Elizabeth Langdon. Our focus today, and my focus, has been largely around the impacts on individuals, and I frame my comments in terms of our responsibilities under the Public Administration Act to provide workplaces that were free from harassment or bullying. But one of the things that's going to be firmly in your minds, I'm sure, is the delivery of services to the community. And in particular, the delivery of high-quality health services to the community, ensuring that the health services that you're managing and operating are delivering safe, high-quality outcomes for patients. And it's very interesting when you dig in behind the data to see there is a clear association between the way in which workplace behaviours operate and clinical outcomes. I'm not intending to explore that theme in any detail here, other than to draw out some of the findings from the data that are in the People Matter survey. And in particular, the People Matter survey asks staff who are responding whether patient care errors are handled appropriately in their work area. And it's interesting to see the gap between those respondents who say they did not experience sexual harassment and those respondents who said that they did experience sexual harassment in the workplace. You'll see with those that responded that they had experienced sexual harassment in the workplace actually had a lower response rate to that question of whether patient errors are handled appropriately in the work area. And it's an even stronger association shows up on perceptions of whether management is driving us to be a safety-centred organisation. Those that responded to the survey that they did not experience sexual harassment respond more positively to the question, is management driving a safety-centred organisation, than those who had suffered from or reported experiencing sexual harassment. It really draws to mind some of the work that Atul Gawande has done in the United States, drawing out really the importance within our health services of moving cultures in our health services to make a real difference to the quality of care that is being provided to patients. In Gawande's words, moving away from an old culture in healthcare of having cowboys, in his words, to moving towards more of the pit teams, the teams working together to provide high quality care. And then finally, on the question, I would recommend a friend or relative to be treated here. Again, we see a gap between those who report not having experienced sexual harassment in the workplace and those that report that they did experience sexual harassment, and with impacts also through to perceptions of overall job satisfaction. People Matter survey, as you know, also collects statistics on levels of bullying. And my comments to date have had, I guess to a certain extent, a negative tone to them. And the reason for that is we've got a serious problem and we need to be taking it very seriously and addressing it quite vigorously. But I think it is also good to be able to report to you some of the progress that we're making, and particularly that your sector is making. And some of that progress is highlighted in some of the statistics I will show you in a moment around bullying. So these statistics go to bullying rates across public health services, so broken down again by levels of health service across metropolitan, regional, rural health services, small rural health services, and then finally total public health. And overall bullying levels are very similar to the levels that we see within the public sector as a whole. But this next graph is very, very interesting, and is the one that indicates progress is being made within in your sector, certainly on the question of bullying. So I know it may be difficult to read all of these lines, so I'll describe the graph to you so you've got a clear picture. The line at the top, the red line at the top, shows bullying rates for the public health sector. The line in the middle shows overall rates of bullying, and then the bottom line is a light grey line which shows the rates of bullying for the remainder of the public sector. So you just have to bear with me for a moment as I just read out the precise numbers to you. For this year, the previous slide reported to you for health a overall bullying rate of 17%. For the rest of the public service, or public sector, sorry, excluding health, the rate of bullying is 16%. So I said a moment ago, your rate is now becoming broadly similar to the rest of the public sector. Too high, but close to what we're seeing across the public sector. But if you look back a few years ago, that was not the case. So you'll see the gap between the red line and the light grey line was really large. If you go back to 2005, overall bullying rates reported in the health sector were 26% in 2005 against 18% in the public sector as a whole. So there's clearly some strategies that you're putting in place that are making a difference, and we are seeing change within the sector. So I didn't want my comments today to be all about the negative, even though I think it is very, very important that we're focused on the challenges and recognising that where we are is at levels of bullying and sexual harassment which are unacceptable, and we need to continue acting on those. Similar sorts of pictures as was provided with sexual harassment. I thought it'd be useful to break this down by different levels and occupational groups, showing you the bullying rates. And again, we see our nursing staff reporting the highest rates of bullying within the workplace, and appreciably higher, almost 20%. So remember, this, of our almost 50,000 people, this is 10,000 people. Sorry, my maths is wrong. I've just extrapolated from nurses to the group as a whole, haven't I? The number would probably be more like 7,500 is my guess across the sector as a whole. But for nurses, it's 1 in 5, which is a really high level of reported bullying in the workplace, and higher than we see amongst other groups within the public sector. I think it's well known that bullying rates can have quite significant impacts on people's perceptions about their overall job satisfaction and engagement, and indeed that's shown out in the data with particularly around overall job satisfaction, a clear difference between those who haven't reported bullying and those report bullying within the workplace. So what are the things we need to do? Kim spoke initially about some of those particularly tricky problems and difficult problems that you may have to grapple with from time to time. That critical clinician that may be behaving inappropriately within the workplace. How are you going to deal with that case? How are you going to deal with cases that may involve poor behaviours by senior leaders? Some of these are very, very difficult issues to deal with, and I see forums like this as being enormously valuable to compare notes, to share stories, to work on what might be the most effective way of dealing with those problems. There's maybe a few key points that I think are worth having towards the list. Is one is always, even if significant progress is being made within your organisations, constantly being aware that everything is not okay. This is a problem that we have to continue to work on. This is about ongoing cultural change. It's not a one-off campaign. I think everyone in the room here and watching on the webinar is completely aware of that point, and indeed the reason why you're here today. The importance of being very explicit, calling out the behaviours, collecting the evidence and using the evidence to track our performance over time. People Matter survey, I think, is a very, very important component of that. It shouldn't be the only component that we're bringing to bear. And indeed, I'd be strongly encouraging health services within each of your health services in thinking about what are the complementary measures, what are the other things that you're going to be doing to be reporting, monitoring your progress. And importantly, calling out again and just emphasising the importance of seeking out advice and assistance. The Department of Health and Human Services is here as a critical resource for you to be able to tap into, particularly when it comes to dealing with some of the most sensitive and difficult problems that you may have. I certainly see the role of the Commission as providing very important service and support to you as well, and particularly working closely with the Department of Health and Human Services, and certainly work very, very closely with Kim Peake and her team in making sure that we're available to provide advice and assistance when there is a difficult problem that needs to be managed. It's very, very important that you don't see this as something that has to be managed on your own if you ever find yourself dealing with those sorts of concerns within your health service. Sometimes we have a tendency to sometimes gloss over some of the basic things we need to do in our organisations, and I think it's always worth spending just a moment to just keep in mind a simple checklist of the things that we need to make sure that are being well managed within our organisations, whether we be executive managers and having the responsibility for actually delivering the services and managing the workforce, or whether we're board members in providing oversight and accountability of executive management. Under the Public Administration Act, directors have a very significant obligation to be ensuring that there is effective accountability and holding executive management to account, asking the difficult questions, ensuring that the board is actually focused on these questions as a matter of core business and doesn't become something that is being reported on once a year when the People Matter survey comes around. So clearly ensuring that standards and expectations around behaviours are set out and reinforced within the organisation. Those systems and processes that promote transparency and encourage a proactive approach to reporting is so important, and continuing to work on those organisational approaches that are embracing and facilitating accountability overall. Again, a really fundamental part of dealing with this problem. Practical systems to support managers and staff to provide them with the guidance they need. This is an area I think we really do need to focus on collectively to make sure there's much better advice and material available for our managers to ensure that they respond effectively to to situations of sexual harassment or bullying in the workplace, so that we start to make real inroads on those statistics that I showed you early on about our staff not reporting incidents of sexual harassment because they just didn't think it was going to make a difference. And when they did report and lodge a formal complaint, an overwhelming majority coming away either thinking that it really didn't make a difference, or they were actually dissatisfied in the way in which their complaint was handled. I see this as being a really important area for us to work on collectively, and particularly sharing the lessons of good practice where where a particular health service is making real inroads and developing great material, making sure we've got ways of sharing that and learning from one another so that we can collectively improve over time. And from my perspective at the Public Sector Commission, very, very interested on the journey that you're on to learn from the strategies that you're implementing in health so that we can take some of the best of those strategies and actually communicate them to other parts of the public sector. So within the public sector, we can be collectively learning from each other. And importantly, a clear focus on training within our workplaces and recognising that the systems and processes to deal with this problem need to be underpinned by formal training and formal awareness raising. So I touched on a moment ago the role all of us have to play. This is a collective endeavour, bringing all of us together: executive management, directors, the Department of Health and Human Services, and sitting behind the Department of Health and Human Services, the Victorian Public Sector Commission, supporting you in the work that you're doing. I'm enormously encouraged that there are so many leaders dedicating a full day today to talk about this topic and to be sharing insights and perspectives. I think it really sends very strong, powerful signals that we in Victoria are making a really focused, concerted effort on this problem. I feel very optimistic that with a concentrated senior leadership over time, we'll make very, very significant progress on this problem, that Victoria will be able to say that it is genuinely leading the way nationally and is leading the way internationally, and not only because it is the right thing to do for our staff, not only because we've got a piece of legislation that tells us that we have an obligation to provide workplaces that are free from harassment and bullying, but importantly in the health context, that we are actually developing those environments that are conducive to the delivery of high quality and safe clinical services and experiences for our patients. So I want to thank you again for the opportunity to be able to talk to you this morning, for the opportunity to join you for a short while. I'm very, very interested in hearing how the rest of the day goes and would very much like to stay in touch, and want to emphasise one more time that the Commission is here to actually support you in your health services in the work that you're doing. Thank you.
Now, we have 5 minutes, and Paula said he's very happy to take any questions. So, yes, and we have someone straight off the mark. Fantastic.
Paul, are we able to tease out in the sexual harassment experience how many of those arise from staff or organisational staff versus patients or relatives who might be...
No, this is a very, very good question, and one that I actually don't have the answer to that, but I think it is a... Yeah, I will repeat it, but I will come... I think it is something very important for us to follow up on. So the question was, can we tease out just how much are those figures influenced by experiences with patients as opposed to with colleagues or managers within the workplace? How much have they been affected by experiences in the workplace? I don't have the figures on that, but I think it's a really important question, and I'd be very, very happy to provide further information and circulate it to everyone after this, if there's anything more that I can find from our statistical experts.
Anyone else? Yes?
Everything you've said has been great, but I'm just wondering, what about patients who get bullied in the hospital?
Patients being bullied by health professionals. Well, that would be... I'm going to start out with sort of a VPSC hat on, you know, as from the Public Sector Commission's point of view. Immediately, I would say that's an immediate breach of the public sector values. We actually have... Our values mean that we have to operate with ethically and with integrity and fairly to members of the community. So it is actually a breach of the code of conduct to bully patients. I'm not sure I can provide too many more insights on that question though. I will wager one, just before I finish, I will wager one hypothesis, which I'm sure if someone was able to conduct a study, that my hypothesis would be that if there are poor behaviours within the workforce, that would be associated with poorer behaviours in relation to patients. That would be my strong suspicion. But everyone here in the room will probably have a deeper insight into that question than I would, because you're actually out there experiencing things day to day.
We have one over there. No, there's another one.
Thanks, Commissioner. Trevor Adam, East Wimmera Health Service. In our health service, we've endeavoured to do some work around identifying the difference between inappropriate behaviour and bullying. So inappropriate behaviour being something that may be less repetitive. Has the Commission, through the survey, endeavoured to try and separate the two, so that we understand that the bullying figures are genuinely bullying as opposed to a one-off effort of inappropriate behaviour?
I don't think we can adequately answer that question. But again, if there's anything that we can tease out of the data, I'd be very, very happy to take that on notice and see if we can provide any more information after this. I should actually mention at the moment the Commission's undertaking a review of the People Matter survey to see whether the People Matter survey is measuring everything that it could effectively measure. We're very, very conscious of the need to keep the survey at a manageable length. We saw quite a substantial increase in response rates from last year to this year with the People Matter survey, and our strong hypothesis is that is heavily associated by the fact that we actually reduced the length of the survey from last year to this year, and it actually helped people stay with the survey right through to the end and lodge it. So in doing the review, we're very, very conscious of the need to make sure that we get an effective balance between asking the right sorts of questions that are giving us the insights that we need, and ensuring that we don't have too many questions in the survey. I mean, on one level, I'm keen to get as much data out of the survey as possible, but recognising if we don't have the high response rates, will undermine other value the survey may have. But very, very happy to take that further on notice.
Yeah, and then there.
Paul, thank you. What you've said is really interesting. What I'd like to know is whether you have any evidence of complaints arising from third parties calling out behaviour.
Not through the People Matter. So the question was, do we have evidence of third parties calling out bad behaviour? So the experience of third parties, I assume in the workforce, that have called out bad behaviour, perhaps made a report to management and their experience on how that's handled. To the best of my knowledge, there's nothing in the survey that really gives us deep insight into that, but if there was something, I would certainly come back to you.
Commissioner John Rales of Latrobe Regional Hospital. I just wonder, have you done any research in relation? I guess there's been a culture of increased accountability and performance in organisations like hospitals. Have you done any research in relation to performance management and the difficulties that could cause in conversations with staff versus bullying? And is there any evidence to show that there's correlations there?
The short answer is no deep research that I'm aware of, but it's actually an important question, and one that I'd be that I'd be quite interested in, because, as I indicated, one of our roles is to actually share better practices across the public sector. So if you've been doing particular work in that area, I'd be interested in learning about that, and very, very happy to take that away as something that perhaps we should be penciling into our work program, actually, to be doing deeper work on.
And I have to call this as the last question over there.
Does the data tell us anything about who's actually doing the bullying or the sexual harassment, perhaps breaking it down into categories like peers and supervisors or administration?
Yeah, and that went partly also to the question of the breakdown with whether we have any insights into being associated with patients as well. So I think what I'll do is see if there's any further information I can provide and then circulate that to you. I'm sure that can be organised fairly easily through the Department of Health.